Welcome and thank you for standing by. All participants are in a listen-only mode for the duration of today's conference. Today's call and session is being recorded. If you have any objections, you may disconnect at this time. I would now like to turn the call over to your host, Earlene Dowell from the Census Bureau. Earlene, you may begin.
Thank you, Anthony. Before we begin, a few housekeeping items. We will save all our questions to the end of the presentation. Please add your questions into the Q&A box and we will read them out loud after the presentation. The chat has been disabled to our attendees at this time. Good afternoon, everyone, and thank you for joining us for the June Local Employment Dynamics, or LED webinar. On behalf of the U.S. Census Bureau and the LED Partnership, in collaboration with the Council for Community and Economic Research and the Labor Market Information Institute, it is my pleasure to welcome Scott Bailey and Annalise Van Sherman as they present Using Census Data and Quarterly Wage Files to Analyze the COVID Recession and Recovery. The COVID-19 pandemic ushered in a period of swift and deep labor market disruption and uneven recovery that varied by industry and community. This presentation begins with a high-level overview of impacts of the recession and recovery in Washington State using standard measures of the labor market, the unemployment rate, and non-farm employment. LEHD products were particularly valuable for adding insights on the connection between employment and characteristics of people who are employed in different industries by exploring selected industry employment patterns to determine how different communities were impacted. Scott Bailey has served as a regional economist for the Washington State Employment Security Department for over 33 years, covering Southwest Washington. In addition to serving his region, Scott has produced statewide analyses of hourly wage trends using quarterly wage files. Years ago, he partnered with Census, helping to train analysts in other states on how to understand and use LEHD and On the Map. Scott is a board member of the Pacific Northwest Regional Economic Conference. He also served a term as a school board member for Portland Public Schools. Scott holds a master's degree in economics from Portland State University. Annalise Van Sherman is a regional labor economist with the Washington State Employment Security Department, a position she's held since 2010. She works closely with economic and workforce development partners, media, businesses, and others throughout the North and Central Puget Sound region and statewide, providing local labor market intelligence to help inform strategic decision-making. In addition to her work with the state, Annalise serves on a number of boards and advisory committees, including the Pacific Northwest Regional Economic Conference, the Seattle Economics Council, the Skagit Population Health Trust, and the Border Policy Research Institute, as well as several K-12 career and technical education and college workforce advisory committees. Annalise holds a PhD in economic geography and a master's degree in applied economics, both from the State University of New York at Buffalo. With that, I welcome Scott Bailey.
Thanks, Earlene. And it's afternoon for some of you, but here in Portland, Oregon, it's a beautiful sunny day out. I hope it's sunny wherever you are. Let's just jump right in. So want to begin with covering a couple of themes that we'll be talking about. This is kind of a meta presentation. It's not meant to be an in-depth, comprehensive look at what happened to the state of Washington. What we're going to try to do is show how we use data and in ways that you can use in your state to help understand what happened with the recession and recovery. So some themes. First of all data is beautifully flawed. Some of it not so beautiful, actually. As the philosopher Nietzsche said, paraphrase, all numbers are lies, but they're lies that we cannot live without. Annalise?
Yeah, Scott, I need to supplement that with the wise words of Rich Vance, my father and a chemical engineer, who said, math doesn't lie, numbers don't lie, but they sometimes tell you your instruments are broken, or that you collected the wrong data, or that you're interpreting it wrong, or that you did your math wrong. So along those same lines.
Secondly, and as Engineer Benz would say, pay attention to margins of error. For some data sets, they're quite large, and for some demographics, especially if you drill down, and others, they're small. Thirdly, and we'll be showing this, triangulate from multiple sources whenever possible, because again, all data sets have their strengths and weaknesses. Disaggregate to get the nuanced story. And finally, so much data, so little time. We'll probably not get through all our slides today, but there you go. So I want to begin by bringing up some demographic issues. This slide compares population in the state of Washington, the 2010 census versus the 2020 census by race and ethnicity. And you can see Washington's population has been diversifying over time, but look at that number for multiracial. And I think a couple of things are behind that. One is that the census changed how the questions that I think helped more people to get, instead of checking one box or another, help more people, more respondents have a more nuanced or express a more nuanced role of how they see themselves. And that's anecdotally true for younger adults as well. If you look at the folks at Office of Financial Management are highly skilled demographers. I love them. Here's a comparison of their preliminary 2020 estimates with what the census actually said. They were off by about 50,000 jobs, which over a 10-year period, I think is pretty darn good. It's really pretty close estimates for a number of demographic groups until you get that get to that point where we're dealing with multiracial. And you see there's been some big shifts, which again, I think is because with different questions, people express their identity in different ways. What this means, and particularly with LEHD data, where we're looking at employment and wages by race, it raises some questions for how we can analyze the data. Now, LEHD the data seems to be pretty continuous so far with the 2010 estimates of employment by race. But in future, that may not be so. And particularly as we add more, probably we'll add more major racial and ethnic categories like Middle East, North African, which I think is a really positive development. And as a data analyst, brings continuity of analysis over time into question. That's a small price to pay. So, and in particular, because critical census inputs from the 2020 census have been delayed in terms of delivery to the states, we don't have a re-estimate of 2019 population. And that's puts a spanner in the works when we're trying to compare 2019 as a pre-COVID year with the impact of COVID. Because ideally, employment trends would be compared with population trends for context. For example, if we looked at indigenous employment, and if that grew at the same rate as total employment, but the indigenous working age population grew faster than the average, then that employment population ratio would actually decline for indigenous people compared to the average. So, but we can't make that judgment without having the underlying population numbers. Similar concerns with the shifting of age groups. You can say, wow, an age group grew or didn't over time in terms of employment, but underneath that, there is a shift in terms of the number of people in that age group that ideally we'd have that to compare to. Also, LEHD, like any data set, and I love LEHD data, all data is issues, but when it comes to LEHD, missing data is always an issue. So if employers don't report some data in terms of the wage file data, for example, then there will be little holes in LEHD because they rely on that. There are other issues as well, and in particular, the NAICS code updates over the last 2 years have been a challenge for us here in the state of Washington. So in particular, this is the beginning of quarter employment for a new NAICS 4599 miscellaneous retailers. And you see, it looks like in the first quarter of 2018, 30,000 jobs disappeared. Well, it turns out that they showed up in clothing retailers for 1 quarter and then shifted to department stores, again, another new NAICS, and then seemed to disappear for a couple of quarters and then come back and then go away for good. Where they showed up in electronics and appliance retailers and then shifted to corporate offices, which is probably where most of them belonged, but there was also an uptick in warehouse and storage. So some major continuities. So if you're, the lesson here is, you need to drill down to, in this case, 4-digit NAICS to see some of these trends. I don't know if they're happening in your state or not. And B, if you don't do that, you might draw some conclusions from, say, a 2-digit NAICS trend that wasn't warranted. Now that drop in the middle around 2019 turns out to have been missing data and not a NAICS issue. And you can see that by the huge number of separations in that NAICS that showed up, and then the huge new hires that showed up a couple of quarters later. Okay, so now we're going to jump into some actual just basic overview of interpreting what happened in the state of Washington, looking at 3 different factors. First is unemployment. You can see we had a huge spike in unemployment, of course, with COVID, and then it's back down to really almost historic lows in the state of Washington and nationally. A couple of things. If you paid attention to what the Bureau of Labor Statistics was saying, that spike in unemployment was likely 3, 4, 5 percentage points higher than the official record due to issues with how people answered questions in the current population survey. Second thing, of course, is that the unemployment differed quite a bit by race and ethnicity. And also different demographic groups responded differently when they separated from their job, whether they lost their job or they left their job due to any of a variety of concerns during COVID. Some people stayed in the labor market and were counted as unemployed, while others left the labor force and so weren't counted as unemployed. And those that rates of leaving and where they ended up in terms of how we count unemployment and labor force differed by different groups. And you can see labor force participation rates dropped and then recovered. And again, you have to factor in demographics here, particularly with the aging population. Much of the decline in labor force participation over the last decade has been due to the aging of the workforce. There are other issues as well, of course. And here's a familiar graph popularized back in 2008 by Bill McBride over at Calculated Risk, a great blog, which shows that we had nationally about a 14% drop in employment, non-farm employment, locally in Washington about 12%, but tracked it pretty carefully, pretty closely throughout the recovery. And many of you have probably seen or prepared a slide like this, which shows the different fortunes of industries through the recession. Again, starting in February 2020 as the touch point and the most current data. So you see in Washington, for example, that big drop in aerospace employment as part of manufacturing. It's a very important industry, and there's been very little recovery in that industry. and huge growth in professional services, information services, corporate offices. A lot of that related to, quote, tech employment, unquote. And now I'm going to turn it over to Annalise and to show the value that LEHD brings as you drill down into the industry level. Annalise?
Great. Yeah, thank you, Scott. So just as a reminder, this is kind of a meta presentation. This is not a polished product, but just to show how a number of us have been looking at our traditional data sources, largely BLS, and then bringing in other pieces of data from BLS, from Census, from LEHD in order to make more sense of, to contextualize, to kind of double check and understand more completely what happened. So in this case, I'm looking at healthcare. The lens I'm looking at is the industry lens, and chose healthcare for a number of reasons. Of course, healthcare was absolutely impacted for a number of reasons with regard to COVID. The question of essential workers and turnover, especially in the last several months. And then the shift of, what the implication of the loss of some care-related jobs means, formal care-related jobs, and shifting that work to informal care economy or largely families. So that's the explanation. And Scott, next slide, please. This is not a slide I'm going to go in detail with, but just one to familiarize you with how a lot of these slides are going to be read. This has been my roadmap since the beginning of the pandemic. I took all of the industry sectors in Washington State, normalized them to calling February 2020 100% employment, and then letting it go and letting it, watching what different industries did over the course of the pandemic. And so just pointing out a couple outliers that bookend this. At the very lower end, you see that dark green line. That's leisure and hospitality, losing about 40% of all jobs in the course of just a couple months, and having a steep but initially very tenuous recovery. At the top of the chart, you see our information sector, a very large sector in Washington State with a lot of software publishing activity in particular, an industry that accelerated growth into the during the pandemic. And then every other industry kind of falling somewhere in between those two. Next slide, please. So we're focusing on healthcare and just looking really at first glance, when we look at the 2-digit level, NAICS 62, which is healthcare and social assistance, we see a relatively low impact initially compared to when we aggregate all industries together. And, if recovery, if you can call, the same level we were at in February 2020 full recovery, then we reached that point in 2022. But as with any story, it does take looking beneath the surface to help flesh out some of those challenges. So begin with total in healthcare, and then we drill down to the 3-digit level. This is still looking at our Washington quarterly benchmark series, which is an analog to CES. Outpatient care, doctors' offices, dentists' offices, and so forth, had a very large, significant drop in employment early on, but rebounded fairly quickly and has been seeing some growth. But when we go to hospitals, NAICS 622, the purple line, we see generally relatively lower job losses, some job losses starting in 2022, beginning to recover from that. But overall, a lot of stability when we look at hospitals. But then when we look at NAICS 623, our nursing and residential care, we see a very different pattern and a troubling one. Extremely deep job losses, but not that initial spike. It's much longer term, continuing to drop into 2022. Beginning to recover, but still well below pre-pandemic levels. Next slide, please. UI claims. This was absolutely indispensable as we were making sense of the pandemic. A lot of LMI shops around the country were taking a very close focus on UI claims. This is our healthcare and social assistance claims. Most of these came from that initial spike that you see is largely from doctors' offices, dental offices. In addition to seeing a lot of SOC, job categories such as cashier and cook and waitress, we saw a lot of dental hygienists in that first wave. and then dropping off very quickly. Next slide. So now we can dig into the 4-digit. Our CES measure does not allow us to go all the way up to this. It's going to be lagged behind a little bit. So we turn to our QCEW to take a look at 4-digit NAICS. So these are what the slide we were looking at before. When we break it down, long-term care, this gray line is often called skilled nursing, NAICS 6231, an even steeper drop than what we see in that 3-digit aggregation, and one that's beginning to reverse, but still about 20% below levels that we saw in February 2020. Residential care, this green line that largely hugs that nursing and residential care. Residential care is going to refer to mental and substance abuse, residential services, group homes for developmentally delayed individuals, and so forth. And then we look at elder care and child care. I added child care in. It's a different 4-digit, it's different at the 3-digit level, but still ties into that care economy. Elder care, relatively shallow losses. When we get to child care, the turquoise line, extremely steep losses. Coming back, a fairly steep recovery. At this point, we probably, when the next quarter is released, have reached pre-pandemic levels, but you can see a tremendous amount of variation when we get to the 4-digit NAICS level. Next slide. Okay, so not only does it have its implications for workers themselves, and when we're thinking about the care economy, families and how they're going to navigate, this also amplified systemic challenges. I put two headlines from the Seattle Times. Harborview Medical Center, which is our state trauma center, will temporarily stop accepting some patients due to capacity issues. This is in August of 2022 when you see that slight dip in employment in hospital employment, but this is also when you're seeing skilled nursing bottoming out and that long-term care. And that whole article centered around there were no places to place patients who were no longer in need of acute hospital care, but were not ready to go home. They needed that long-term skilled nursing, and there were no beds available. So this has amplified some systemic challenges. A recent article in the Seattle Times, an opinion piece, calls for an update to Medicaid rates to ease long-term care staffing crisis. So the long-term care question is absolutely critical as part of a systemic view. Okay, next slide. So this I decided to look a little bit closer at long-term care, and indeed it has been in long-term decline. But one thing that really struck me is this is not unique to COVID-19. We were seeing an acceleration in long-term downward trend for long-term care as we were coming out of the Great Recession. So as we were seeing the low unemployment rates that preceded the pandemic, as we were seeing a really strong labor market, we were already seeing these numbers dropping off, which begs the question of why. Is this why what does turnover look like in this industry? What is it that is driving a decline in the number of jobs in the sector? So we can use LEHD to help figure some of that out. So the question of turnover. Again, I'm going to go over to one of our tried and true. We've got the JOLTS data set in BLS. And although they have recently released statewide total numbers, you can't dig down at an industry level. So looking at a national level, we can look at 2-digit healthcare separations, and we get a fairly clear idea that healthcare has less turnover, fewer separations than the total economy as a whole. This also applies to next slide when we look at hires, fewer hires. So together, this says there's less turnover in healthcare at a 2-digit level nationally compared to the whole. Then we can turn over to LEHD, and this is one way I love using LEHD, where we can take a look not only at what turnover looks like in our states, in our respective states and some counties, we can also drill down to that 2, 3, 4-digit level. So right away, just looking at JOLTS, does this tell a similar story? Yes, it tells a very similar story. We're seeing relatively less turnover in healthcare than we are in as a whole until recently, when we're seeing significant turnover showing up. So definitely an industry to be watching. Next slide, we can look at a 3-digit level, and when we add outpatient care, fairly stable, fairly low turnover. We add hospitals in, much lower turnover, although we are seeing quite a bit of increased turnover in hospitals recently. And then finally, when we look at nursing and residential care, we are above average, for all industries when we look at turnover in nursing and residential care. So we're seeing something here. We can look further at the 4-digit level and add in long-term care, higher than average. Look at residential care, about average, about similar to total employment. Then we add in elder care and child care, which rise to the top in terms of, for this sector, extremely high turnover relative to what we're seeing elsewhere. Very different from the hospitals, certainly. So this calls for that question about looking at wages. We can use LED's EARN-S dimension and look at, and we can also add in gender. So I looked at male and female. When we look at all NAICS and we just look at healthcare, okay, we have a gender gap that's similar to all NAICS altogether, but we have somewhat lower wages. When we look at outpatient care, widened wage gap, but overall wages look pretty good. When we look at hospitals, wages look relatively good compared to the whole. But then we get to our friend 623, nursing and residential care, and all of the components that make that up, plus childcare, and we see much lower wages than the average, much lower wages than healthcare at a 2-digit level, and a lot more wage parity when we're looking at male versus female job holders. Next slide. We often hear about how this pandemic really impacted the female workforce, and this is another way that we're really able to use LEHD to build context. This slide just looks at that initial drop from February to April, from that first quarter to second quarter of 2020, what those job losses looked like, and then overlaid with the proportion of the workforce that is female. I only kept the ones that have 50% or more female workforce, and we see that those are the industries that lost the greatest numbers of individuals. Next slide. Okay, so back to looking at gender, and in our 4-digit industries of long-term care, residential care, elder care, and child care. We know from looking at this, these are industries that have a greater portion of female workforce. We've got this documented in LEHD, so we're not relying on anecdotal accounts. And we can also look at how that tracked over time. And what we see is that although the female workforce is a much, proportionally very large in these industries, these are also the women were the ones who lost their jobs. Women are the ones where we saw that attrition from the workforce in these industries as well, whereas male employment remained fairly steady. Next slide. And then, of course, and I'm not going to go into all of the possibilities because so much data, so little time, but also just to point out that we can look at other dimensions such as age, race and ethnicity, and education using LEHD. And what we see looking at this 3-digit category of residential and skilled nursing is that we see those job losses were concentrated among workers aged 25 to 44, whereas when we look at the other end of the age spectrum, 65 plus, it tended to be fairly steady. And looking especially at 25 to 34, we're still seeing that dropping. So at this point, I'd like to hand it over to Scott to look at some other dimensions.
Always helps to unmute. Thanks. So I'm going to first take a look at wages from the quarterly wage files in combination with LEHD. So Washington is one of a handful of states that in our quarterly wage files, and these are in the state of Washington, it's 4 million records roughly every quarter with individuals and working at a job at an employer. Most states just collect the wages paid to that worker. Washington is one of a handful of states that collects hours worked, so we can calculate an hourly wage for, again, something like 4 million workers. And it's a lot of rich opportunities for analysis there. Also look at quarterly wages, which is a different dimension of wages from LEHD, because that looks at actually what workers take home as opposed to the hourly wage. But first I want to go back and talk about hospital employment. Again, one of our themes was sometimes the data sets don't agree with each other. This shows for EMP shows a decline over the last couple of years, fairly substantial in hospital employment. And most of those jobs were a decline in female employment. However, if you look at QCEW, it shows relatively little job loss over that period. So what's going on? So I looked at two other employment indicators from LEHD to see if there was any kind of issue, and they both agreed pretty much with the trend of EMP. And then I looked at the Washington quarterly wage files and just looked at the number of records for employees at hospitals, and there has been something of a decline. So it's worth exploring more, but I think what may have happened is a shift from part-time work to full-time work, which would mean a drop in the number of wage records and would show up in LEHD as a decline in employment. But still a high number of employees, so maybe less turnover. So I'm trying to still figure that out, but it's, and sometimes data sets just disagree though. Okay, so I want to jump into wages. The Atlanta Federal Reserve Bank developed a tool called the, I think they call it the Wage Tracker, which tracks the median over the year increase in hourly wages, hourly wage rates. So for most of the period going back, 25 years, the average raise that a worker had over a year was about a 4% increase in their hourly wage. Until fairly recently when it shot up to historic highs. Now this isn't adjusted for inflation. Here's the rate of inflation. So you can see that when inflation started spiking in 2021, it rose faster than wages. Wages have been trying to catch back up. So we had real wages dropped until the last few quarters. Now with Washington, we can construct the same kind of thing, except instead of based on a relatively small current population survey, it's based on 4 million wage records. And you can see that workers in the state of Washington fared better, and their incumbent workers' wages at the median kept up with inflation, and even a bit more so. And if you parse this out and look at the, say, bottom 20%, 25% of workers, both nationally and statewide, it was higher. And research has shown that it's that bottom 20% were the, nationally, were the only group that kept up with inflation in terms of wages. So what I'm going to do here is show how wages changed for, on the left, the bottom, the lowest paid 10% of jobs. In the middle, the lowest paid 25% of jobs. And on the right, the median hourly wage in the state of Washington. So for all industries, all those measures went up by about 8%, faster than inflation. That's adjusted for inflation over the 3-year period. This is comparing 2019 Q2 pre-COVID with the latest I have. And this shows nursing homes. And what this indicates to me is that nursing homes were really trying to compete for workers. For childcare, it was wages went up about average and a bit more than average once you got above that lower 10% of jobs. Hotel motel was about average until you got to around the median, where there was less competition for workers. And you see restaurants there and other food services, which is largely fast food workers. They were competing more for workers than full service restaurants were. Another angle that we can look at is the change in average wage for new hires. And that went up quite a bit. And what I'm comparing here is the LEHD data for new hires with the hourly wage files for all workers and then at the median. And what we see is that same difference. And notice the bars in the middle look pretty close to the bars on the left. So even looking at hourly wage file versus the change in take-home pay differed quite a bit by industry. And again, looking at that competition for new hires, hotel motel were not in the game, basically. Okay, so that's just a couple of examples of how we've used wage data to look at some of the dynamics in the labor market. Now I'm gonna, to kind of close out here, I'm gonna use LEHD data to look at African Americans during COVID. Look at unemployment, employment, particularly the pace of recovery and industry trends, and then look at wages. So this compares the labor force participation rates using the American Community Survey annual average with the current population survey, which is a very small survey in the state of Washington. And then when you narrow it down to African Americans, even a smaller sample. So a huge plus or minus here to keep in mind for the CPS data compared to the ACS, which is still a fair amount of fairly high margin of error. So this compares the ACS and the CPS for, and the CPS, this is a 12-month moving average for all workers, and they're really pretty close, which is heartening. And here's the comparison for African Americans. Quite a bit of difference between the two, but they still both in general point to a higher labor force participation rate for African Americans in the state of Washington compared to the overall population. With the unemployment rate, again, pretty good agreement with ACS and CPS, and some variability there with when we narrow it down to the African American workers, but in general a higher unemployment rate. And with the CPS, again, big plus or minus. Nationally, the unemployment rate for African Americans was at a record low. I believe it was 4.7 2 months ago. We don't yet see that happening in the state of Washington. But again, big plus or minus there, and that's a 12-month moving average. Oh, and by the way, the 2023 data is the average for the first 5 months of the year for 2023. Okay, so now I'm going to look at LEHD data and look at employment using 3 different employment measures that LEHD has. EMP total just looks at a single quarter. EMP looks at jobs that are 2 quarters in a row, and EMP-S looks at jobs that exist 3 quarters in a row, and that is by a job I mean an employee with the same employer. So it's a narrower look. And you can see that in that, if you think of 2020 Q2 is the 1-year comparison, M total is the only one that really shows the depth of job loss. So that's what I'm going to stick to in the next, in the following slides, using that measure for employment. What you can see is that while the impact on African Americans for M total was higher after 1 year and after 2 years, over that last year, the end of 2021 and the first half of 2022, really substantial employment growth. But if you factor in population change, that employment to population ratio was still declined over that time. And this has a whole lot of data by different race and ethnic groups. I want to direct your attention to the 2 columns on the right, which shows the total change over the 3-year period compared with population change. And again, it shows for every demographic group. And that population change is still kind of a moving target. And I've got some question marks there. But that employment to population still declined even through the 3rd quarter of 2022. And if you adjust for population, what state of Washington has maybe barely recovered, even at this point of time of May of 2023. Here's a profile of African Americans in the state of Washington by industry worked in, that they've worked in. And here's a comparison with the overall population. So I've circled 4 different sectors where there's disproportionate differences between the African American job profile and the overall profile. So relatively fewer African Americans working in construction and manufacturing, in information services and professional services. These are all moderate to high wage job sectors, and proportionally more African Americans working in business services and healthcare and social assistance. And I've got about 2 minutes left is what I'm showing. Is that correct? So, so much data, so little time. Here we're drilling down to the 4-digit level, and I need a moment to explain the data here. So I've got the 2019 average employment, the 4 quarters, including the 4th quarter 2021 and the first 3 quarters of 22, average employment there. The difference between the two, so you can see in restaurants, there was a decline of jobs held by African Americans by 360, which was a 2.3% drop. The green in the 2021-22 column indicates these are industries with a relatively high number of African Americans employed. The red are disproportionately low. The yellow means it's questionable data going back to those NAICS code changes, so ignore those numbers. And in the percentage column, the green means the recovery was faster for African Americans in those industries and slower in the red. So I'm going to pick out what I would call a good news story. If you look at software, 3rd from the top, while there's a disproportionately low number of African Americans employed in that industry, it's had huge growth, 44%. That was through the course of COVID, and that was twice the average growth for that industry. If you look at the next 11 industries going down, the same is true for 2 other high wage industries, computer systems design and the consultants at the bottom. High wage industries and pretty rapid growth of African American employment over the last 3 years. But, he said, if you look at average monthly earnings for all industries, compare total population with jobs held by African Americans, there's a considerable gap, and really over 30 years, that percentage difference has been growing over time. Somebody barge in and tell me how much more time you want to give me before we switch to Q&A.
You can take about 4 more minutes.
4 more minutes, okay. So here's a similar slide showing earnings. So those green and the red are imported from the previous slides, and the 3 columns on the right show the average earnings for African Americans in the restaurant industry, for example, was $26.71. That was 38% of the average earnings for African Americans in all industries. And it was 95% of the average wage for all workers in the restaurant industry. So you can drill down here and see a whole lot of detail. Again, if you go down to 4-digit, there's a wealth of information that you can find that you don't get at the 2-digit level. And same there. And actually, I think I'm gonna just blow through these last couple of slides and call it good. Hey, that timing wasn't too bad, Arlene.
That was perfect. So thank you so much, Scott and Annalise. Before we get to the questions, the presentation will be accessible on the Census Academy website at census.gov/academy under the webinar tab in a couple weeks. Anthony has already put that in the chat. Again, please type all your questions in the Q&A and keep your questions pertaining to the presentation. The chat has been disabled to our attendees. And now Tanja will read the questions.
Good afternoon. Our first question comes from Karen. Can we drill down to these topics to the county level?
Yes, that's the beautiful thing about LEHD is that you can get 4-digit NAICS at the county level and by all the different demographics. So absolutely. Some of the 4-digit, and again, this is paying attention to the data. Some of that 4-digit level at the county level, the data has been fuzzed in order to deal with data disclosure issues. So you need to pay attention. If you download LEHD data, there are codes for that that you need to pay attention to. But that's one of the beautiful things, especially compared to QCEW.
Thank you. Our next question is from Rory, excuse me. Are there any specific BLS and or census data tables that you can recommend for us if we want to explore these trends and look at this data for our own state or MSAs?
Yeah, absolutely. I think, you know, we wrote down what the resources we used were, and our contact information is available on this final slide. So I would absolutely be happy to help guide some of that. Primarily in the section that I presented, I was looking at the analog to CES. We have a slightly different version in Washington State where we benchmark quarterly, but CES data from BLS is going to give you that monthly employment view. QCEW, or covered employment, also available from BLS or your state data labor market information shop. LEHD, Scott and I both primarily used the LED extraction tool and QWI Explorer for most of the narrative. And then of course, JOLTS would come from the Bureau of Labor Statistics.
Yeah, it's just look at it all. BEA data as well, personal income data is something to track as well. And BEA transfer payments. I analyzed that data a lot for, again, you can get that at the county level. See what's happening with everything from unemployment insurance payouts to SNAP payments and Social Security, Medicare, Medicaid.
I'd just also like to add the one piece that you might not be able to readily access is the wage piece. The piece that Scott presented is based on internal data that comes with unemployment insurance information. That is not, that would be housed at your unemployment insurance office, whatever that is in your state, and not all states have that breakdown by hourly wage.
Yeah, only four. And as we, just a plug here, as we talk about that nationally, there's been states doing different augmentations to their quarterly wage files. I think it would behoove us to actually do that in a coordinated fashion. And my vote is for hours worked first, and second, county of employment. That's a whole nother topic.
That's a conversation for the legislature, Scott.
Oh, oops.
Okay, thank you. And now for our next question. This is from Rory as well. This might be getting too specific or off topic, but with childcare and nursing home long care facilities, do you think the slow recovery in employment in those sectors could also be attributable to workers not wanting to return to these jobs due to wages, parentheses, not enough incentive, excuse me, and or concerns about returning to working in those settings where people worried about their health, safety, exposure to COVID, potentially, etc., or burnout?
Yeah, I would say all of the above. We know that, informally we hear a lot of accounts along those lines, and we are seeing evidence when we look at the data. The data don't necessarily tell us why. They don't necessarily give us that explanatory piece. But when we do see, for example, in the LEHD information that was telling us that turnover is accelerating in the healthcare sector, that's something that kind of tells us, okay, what are the explanatory reasons? What do we need to be thinking about? And when we build in that local context and we, figure out what we're hearing from people in the field, we know that we're seeing burnout. We know that we're hearing all kinds of accounts of people not, being concerned about their health or health of others. And we also can look at LEHD and see, absolutely, these are sectors that do pay lower wages than average. So there are a lot of different ways that individuals explore for a number of different reasons, but data such as LEHD can really help us figure out who do we need to be talking to and to figure some of these questions out and find out those explanatory pieces. So absolutely.
And we also know that particularly in nursing care, private equity has been buying up some nursing care chains, and they have had a pretty negative impact on working conditions and patient care. That's been documented. And I should say one source that we didn't use is Job to Job from LEHD. And I don't know about Annalise, but I just haven't had the time to really jump in and explore that. But that would bring a whole nother dimension to looking at the COVID recession and recovery.
Thank you.
So much data, so little time.
Thank you. Our next question comes from Charles. Have you tried BEA's state-specific PCE deflators?
No. I don't know that I knew that that existed. Thank you. You learn something new every day. I didn't know that there were, they had developed those. I'll have to take a look. Thanks.
Our next question is from Rory. Yes, our state has its own state LAUS data sources, and I think they do it by weekly wages. Sorry, I got tongue tied there, but that still helps. Thanks. Our next question is from Sherry. Have you considered working with the state-specific health agency to overlay COVID surveillance within the economic data?
Yeah, absolutely. I think that, a lot of this really leads to who do we need to be talking with. And as, speaking as somebody working in state agency, this is a great opportunity to present data that can be helpful for facilitating that conversation between agencies. I can also speak from, working at a local level around public health questions. This does provide a really great opportunity for engagement and overlaying data that a lot of different parties can bring to the table and see where those trends dovetail. So yeah, absolutely. At a local level, I've worked with some of this, but I think that it does provide that, just like, well, as long as people can understand the data that you're bringing to the table, it can be a great conduit to sharing understanding and bringing more perspectives together.
And Annalise and I are newly minted members of I'll call it a big data consortium headed up by the University of Washington, which has a number of state agencies participating. And we're looking forward to even a deeper dive into data going in the future.
That concludes the questions we have for this session.
Great. Well, thank you, Tanja. Thank you, everyone, for joining us this afternoon, and thank you to Scott and Annalise for their excellent presentation. Scott and Annalise, would both of you like to make any closing remarks?
Just want to say thank you to all the good folks at Census. We love you. We love your data. So keep on keeping on.
Yeah, I guess my closing remarks is that there are so many different ways that we can use LEHD in addition to a lot of, other innovations. There's a lot of innovation happening in BLS, at Census Bureau, at other agencies, and some of it coming from what we've learned from COVID. It's a really exciting time to be exploring data and kind of thinking about the questions that it helps us to answer. So thank you so much for inviting us to be a part of this series.
And if any of you have ideas for analysis that you didn't see covered, send them our way. We'd love to collaborate.
All right, thank you so much. So please join us as our LED webinar series continues on July 19th at 1:30 p.m. Eastern Time, when Steve Hossack and Mark Jackman present Visualizing Home to Work Job Locations and Income Demographics using Census Loads Data in a Web-Based Application. Upon exiting this webinar, you will be asked to fill out an evaluation. We would appreciate that you take the time to answer the questions so we may be able to serve you better. Until then, on behalf of the U.S. Census Bureau, enjoy the rest of your afternoon, and thank you for spending your day with us.
That concludes today's conference. You may disconnect at this time.